Hello everybody. Today we're going to look at the muscles located in the gluteal region, and also along with that we're going to look at the muscles on the posterior thigh, which are the flexors of the knee joint, and these are also referred to the hamstring muscles. So first things first, let's go from the top to the bottom. Okay, let's look at the gluteal region. All right. Now, gluteal region, we have muscles that are located in this. By the way, this area here is the gluteal region. So you have the iliac crest above, and you have the gluteal fold below that, and you have the intergluteal cleft here on the medial aspect. And on the lateral side, you have these greater trochanter and iliotibial tract here. So basically, this area is the back part of the gluteal region, and basically it is composed of superficial and deep muscles. The superficial muscles are the gluteus maximus, gluteus medius, and gluteus minimus. And let's look at the superficial muscles now. The first muscle that we see here is the gluteus maximus, and as you can see, this is the muscle that makes the contour of your buttock. Okay, so this is the gluteus maximus muscle. And remember, so we have three muscles here. We have gluteus maximus, medius, and minimus. Remember, and basically these primarily originate from the ilium. Remember, in the ilium, we had on the gluteal surface of the ilium, we had the superior, we had the anterior and posterior gluteal line, then we have the inferior gluteal line. So in between these gluteal lines, we have the anterior gluteal, posterior gluteal, and inferior gluteal line. So in terms of the attachment point of the gluteus maximus is the area of the ilium away from the posterior gluteal line. So we have the posterior gluteal line somewhere around here. So beyond that, okay, that's the attachment point for the gluteus maximus on the ilium. And then also, if you look, it also attaches gives origin of the sacrum, and also part of this coccyx here. And there's also like sacrotuberous ligaments. Okay, so all these areas form attachment to the origin of the gluteus maximus muscle. And basically this converges downwards, okay, and then it inserts to the tuberosity of the femur, but primarily it attaches to the a thick, dense connective tissue band, what we call as the iliotibial tract. So this is the iliotibial tract, and one of the so primarily it attaches to the iliotibial tract, but small amounts, and again, like 25% of the fibers attach to the femur, tuberosity of the femur. So basically, what happens is that so this is the iliotibial tract, all right. So, and then we had another muscle. Remember, in the anterior compartment muscle, we had the tensor fasciae lata. Tensor fasciae lata also inserts to the this iliotibial band, iliotibial tract, along with the gluteus maximus, and it goes all the way down, as you can see, and attaches to the lateral part of the condyle of the tibia. And this area, remember, this area was also referred to as the Jordi's tubercle. So it's an area where the iliotibial tract inserts onto the lateral part of the lateral condyle, which is referred to as Jordi's tubercle. So basically, if you look at the gluteus maximus, okay, so the nerve of the gluteus maximus is inferior gluteal nerve, all right, and the primary function of the gluteus maximus is the extension of the thigh. So it attaches to the femur, and when it pulls, basically it extends the lower limb. All right, and also by attaching to the iliotibial tract, it tenses the knee joint. Okay, it stabilizes the knee joint and basically supports the knee joint from lateral side. So. So the functions of the gluteus maximus is important, like walking and sitting and standing whilst after sitting down, and running and climbing, walking upstairs. All these basically you would stand up. You you stand up, you make a stand up in position. So basically, you're basically extending. You're extending the hip joint, the thigh region. You're extending the thigh region. So when it pulls, okay, and basically the thigh region will go backwards. So let me can you show over here? So basically, the gluteus maximus. So basically, when it contracts, so this is basically the flexion of the hip joint. Okay, this is the flexion. So what it does, it goes backwards. Okay, so this is extension. So this is the flexion, and this is extension. So gluteus maximus is extension motion. Okay, when you're sitting down, you move up. Okay, so that is gluteus maximus. Okay, and then it's a powerful extensor of the thigh, of the hip joint. So basically, if you look at the soccer players, they would have this contour of gluteus maximus, overactivity of gluteus maximus, and they would basically extend their thigh. Okay, so basically, this is gluteus maximus. So if we go down deep, okay, just beneath gluteus maximus, we have gluteus medius. This is gluteus medius again, and originates from the ilium, the gluteal surface of the ilium, and and inserts to the greater trochanter over here. So basically, the gluteus maximus primarily is extensor of the hip joint of the thigh. However, the gluteus medius and gluteus minimus is involved in abduction. So when they pull, so gluteus medius and minimus, when they pull the greater trochanter, okay, so basically it would abduct. Okay, it will pull and it will abduct the hip joint and the thigh. So gluteus medius and minimus, the nerve innervation is superior gluteal nerve. So the inferior gluteal nerve innervates the gluteus maximus, while the superior gluteal nerve innervates the gluteus medius and gluteus minimus. So these are the primary abductors of the hip joint. Okay, so that's about it. You know, these are the superficial muscles of the thigh, and then we have tensor fasciae lata. That's also innervated by the superior gluteal nerve. Okay, so let's look at the deep muscles now here. So these are the deep gluteal musculature. The first muscle that we see here is this muscle here. This is piriformis muscle, and piriformis muscle basically originates. So this bone here is basically the greater sciatic notch. Okay, and then we had ligaments. Remember, we have the sacrotuberous ligament, and we had sacrospinous ligament. Sacrotuberous basically goes like in an oblique direction here, and sacrospinous ligament basically it's a horizontal. It has a horizontal direction, and via these ligaments, attachment of these ligaments, we have these nodules turn into foramens. We have the greater sciatic foramen, and then we have the lesser sciatic foramen. So basically, this is a notch, greater sciatic notch. Now this became a foramen, so this is a greater sciatic foramen. Through the greater sciatic foramen passes this muscle here. This is the piriformis muscle. It originates from the anterolateral aspect of the coccyx. So this is a foramen. Just on the anterior aspect, it originates from that area, and it passes through the foramen, and attaches to the greater trochanter. So most of the muscles here basically attaches to the greater trochanter. Okay, and besides the quadratus femoris is basically attached to the intertrochanteric ridge or line. So all these muscles attach primarily to the greater trochanter. And all these muscles, the activities of these muscles basically are lateral rotators of the hip joint or the thigh. These are all lateral rotators, okay, or external rotation. So basically, this is the piriformis muscle, all right? It attached to greater trochanter. Now piriformis. One of the important things of piriformis muscle is that it divides the foramen into two parts. We have the suprapiriform foramen, then we have the infrapiriform foramen or compartment. So basically, this here. So you have structure that passes through the suprapiriform foramen, and then you have the structure that passes through the infrapiriform foramen. So the piriformis muscle divides the sciatic foramen into two foramens, the upper part and the lower part. So basically, the upper part in the piriform foramen, we have the supragluteal nerve, and then we have the superior gluteal vessels, which is the superior gluteal artery and vein. So, okay, so superior gluteal nerve, and then we have superior gluteal nerves and superior gluteal nerve, and then we have superior gluteal artery and vein. Okay, so basically these, and then these basically go and innervate the gluteus medius and minimus. Okay, then we have the inferior foramen here, and this large and thick nerve that we see here is the sciatic nerve. So so we have the inferior foramen. One of the important structures that passes from that area would be the sciatic nerve. Plus, there's also like posterior cutaneous femoral nerve also passes through the inferior foramen. And there's also other structures that passes through the inferior foramen, would be the nerve to obturator internus, we have that. And then we have the nerve to quadratus femoris, and we have the pudendal nerve, and we have the internal pudendal artery. So those also pass through the inferior foramen. And along with that, we have the inferior gluteal nerve and inferior gluteal vessels, of course. Okay, so those are the structures that passes below or through the inferior foramen. So what are other muscles that we see here? So next, just below the piriformis muscle, we have the superior gemellus. Okay, this is superior gemellus. This is the obturator internus, inferior gemellus, and this is the quadratus femoris. So all these muscles basically. So basically, as you can see, these come out from the originates from the ischium, okay, like ischial spine and ischial tuberosity, okay. So these are the muscles that originate from the ischium, and they attach to the greater trochanter. So when they pull, so basically they would lateral rotate, okay. That would lateral rotate the femur or the thigh. So this is the superior gemellus, and then we have so in between we have the obturator internus, and we have the inferior gemellus. So basically the nerves basically have, so the piriformis, we have the nerve to piriformis. In terms of the superior gemellus and obturator internus, we have the nerve to obturator internus. So nerve to obturator internus basically innervates the superior gemellus muscle and obturator internus muscles. Okay, we have one nerve that innervates both muscles. So this obturator internus, we have inferior gemellus. Gemelli basically are twins. So we have the superior part and the inferior part basically. So this is the inferior gemellus here, and originates from the again ischial tuberosity, above part of the ischial tuberosity here, and then attached to the greater trochanter. And then last we have the quadratus femoris. Again, quadratus femoris originates from the around the ischial tuberosity and attaches to the intertrochanteric ridge or intertrochanteric line. And the nerves to these muscles is nerve to quadratus femoris. So we have nerve to quadratus femoris innervates the inferior gemellus and the quadratus femoris muscle. So basically all these muscles, deep gluteal muscles, basically they contract, they pull the greater trochanter, okay, and you have the lateral rotation movement or external rotation movement. Okie dokie, so that's about it. So this is by the way, this is the ligament here, this is sacral tuberous ligament here, okay, what you see here. So this is the gluteal region. Now let's go to the posterior thigh region now, all right? So posterior thigh region, this area here, basically we refer to these muscles as the hamstring muscles. So basically there are basically three muscles here, and if you want to add the head, there's four, of course. If you want to, so this is biceps femoris. So on the lateral side here, okay. Now let's look at the posterior thigh, which is the posterior compartment of the thigh. And these muscles are referred to as the hamstring muscles, and these are basically the muscles that flex the knee. Okay, when the leg is flexed, so these muscles primarily act on flexion of the leg or the knee joint. Okay, the hamstring muscles. So what we see here is basically so we have three muscles with here. We have the biceps femoris, and then we have the semitendinosus and semimembranosus muscles. Okay, so on the okay. So basically, on the medial part, okay, so we have. So this is the this is the biceps femoris muscle, and this the top muscle here. We have the semitendinosus, and right, and so it's not separated here. So the lower part is the semimembranosus. So semitendinosus is the above muscle, and below muscle would be the semimembranosus. It's membrane shaped. Okay, semitendinosus, you have a circular and a long tendon. Okay, so that's referred to as semitendinosus, and below that is semimembranosus. So all these muscles, the common features of all the hamstring muscles, as you can see, it originates from this area here, which is the ischial tuberosity. So we have the ischial tuberosity from the ischium, okay, and then passes down. And so the semitendinosus, semimembranosus, basically on the medial aspect, okay, so basically they go and attach to the medial part of the medial condyle of the tibia. Now, semitendinosus is specifically attached to an area called as the pes anserinus. So this is pes anserinus. So we have sergeant muscle, remember? Sergeant, we have sartorius, gracilis, and semitendinosus. So we have this. This is the sartorius. This is the gracilis. And then we have semitendinosus, tendons. They unite and they form what we call as the duck's foot, all right? What we call as the pes anserinus. So basically, semitendinosus attached here. However, the semimembranosus attached to the condyle, medial condyle, the lower part of the condyle. However, if you look at the biceps femoris, so we have biceps femoris has two heads, the long head and short head. Long head originates from the ischial tuberosity, and basically they unite and they are basically attached to the lateral part of the posterolateral part of the tibia. I'm sorry, they attach to the head of the fibula. The biceps femoris, long head and short head come together, they fuse with each other, and they attach to the lateral aspect of the head of the fibula. One thing to remember is that the long head of the biceps and semitendinosus, semimembranosus, as you can see, it traverses this joint here. This is the hip joint. It comes from the ischial tuberosity. So basically, since it traverses, it passes the hip joint, they also act on the hip joint too. So basically, what they do, they extend the hip joint here. Okay, when they pull, they would extend the hip joint or the thigh. However, when they go down, and then they also pass the knee joint and from the back. Okay, when they pull, they would pull the leg in this direction. This is flexion. So they flex the knee or leg, and they extend the hip joint or the thigh. All right. And the nerves of these muscles is basically the branch of the sciatic nerve, which is a tibial nerve. However, the short head of the biceps is innervated by the common peroneal nerve. So the sciatic nerve goes down and it divides into the tibial and common peroneal. So the branches, the muscular branch that come out from the tibial nerve innervates the semitendinosus, semimembranosus. However, the common peroneal nerve gives off motor branches that innervates the short head of the biceps. Okay, that's about it, I think. Yes. So basically, these muscles are called the hamstring muscles. And one other thing is that we have the adductor magnus beneath on the medial aspect. We have the adductor magnus. We have the hamstring part of the adductor magnus too. Okay, they call it hamstring part of the adductor magnus. Okay, so basically, I think this is about it. So now let's go to the cadaver and see the structures on the cadaver. Okay. All right. Bye bye. Okay. Now we're with the cadaver. So we're going to look at the gluteal region, and somewhere around here we have the iliac crest. All right. And this is the intergluteal cleft here. This is the gluteal fold, where you have the gluteus maximus, the lower part of the skin. So you have the fold, you have the gluteal fold. So this area here makes up the gluteal region. So what we do is cut the skin. Okay, both the skin and the superficial fascia. I just lift that off. Okay, then we have the fatty layer. Okay, this is the fat. Okay, we can cut that out here. Okay, we'll cut the skin and superficial fascia, lift it off. So what we see here is the deep fascia here, which is primarily composed of again, a lot of fatty tissues. And then I'm going to flip this fatty tissue, deep fascia, out of the way. And when I get that out of the way, the prominent muscle that we see here is gluteus maximus. So basically, this whole muscle here is the gluteus maximus, and basically, so this is the superficial fascia in the skin. This is deep fascia, okay, primarily made out of, again, the fatty tissue. Get that out of the way, all right. So this is the deep fascia that covers the muscles, which is primarily composed of dense connective tissue. It goes all the way down, and this fascia is called the fascia lata. Okay, this is the fascia lata, and it goes all the way down and to the posterior thigh region. Okay, so as you can see, the fibers primarily. It has two attachment points. One, it attaches to the so this is the okay, hold on. Okay, so basically this is the tibial the tuberosity of the femur, or the femoral tuberosity, tibiosity of the femur. And the other part of the gluteus maximus attaches to this band here. This is the iliotibial band, or the iliotibial tract, okay, as you can see. So if we cut the gluteus maximus, and then if I flip it up, okay, the muscles that we see here just below that, we have the before that. So basically, so you have this is the attachment point of the gluteus maximus. So this is the sacrum here, all right, and goes backwards to the coccyx, and you have the sacrotuberous ligament somewhere around here. Somewhere around here is a sacrotuberous ligament. Okay, so when I cut the origin point and flip it over, the muscle that we see here is this muscle here is the gluteus medius. Again, this gluteus medius originates from the between the superior gluteal, the anterior gluteal, and the posterior gluteal line. Okay, so you have the anterior gluteal and posterior gluteal line. At that area, you have the gluteus medius, and then this goes and inserts to the greater trochanter. And again, this muscle. So beneath this gluteus medius, okay, beneath that you have the gluteus minimus. So this muscle here is the gluteus minimus. So both of these muscles are innervated by the superior gluteal nerve, and the gluteus maximus is innervated by the inferior gluteal nerve. Okay, so gluteus maximus is the main extensor of the thigh. However, gluteus medius and minimus are the adductors of the hip joint of the thigh. Okay, so that's gluteus medius here, and so these are basically the superficial gluteal compartment, or gluteal muscles. If we look at the deep gluteal muscles, we would see one of the most important muscles that we see here. This is the piriformis here, actually. This is the piriformis muscle, and basically piriformis muscle comes out from the greater sciatic foramen. Okay, so this is the greater sciatic foramen here. Okay. So this is the greater sciatic foramen. So just on the anterior lateral aspect of the sacrum. It originates from there and then passes through the greater sciatic foramen and divides the greater sciatic foramen into the supraperiform foramen, and then we have the infraperiform foramen. Okay, so from the supraperiform foramen we have these vessels and nerves. Okay, we have the superior gluteal nerve and superior gluteal artery and vein, and below that, this is the inferior gluteal foramen. You have these neurovascular supply. We have the inferior gluteal nerve and inferior gluteal vessels, and as you can see, this inferior gluteal nerve goes to the gluteus maximus and supplies the gluteus maximus. So what else do we find passing through the infraperiformis foramen would be this large guy here. This is the sciatic nerve, as you can see. This whole thing, okay. This whole thing is the sciatic nerve. This thick nerve is a sciatic nerve, and basically this is the posterior femoral cutaneous nerve, okay, along with that. And we also see a lot of other structures, but we can't see it here. And let's look at the muscles, okay. The muscles, as you can see, the lateral rotators. So these are the lateral rotator muscles here. So the first muscle, we have the superior gemellus. Okay, this is the superior gemellus. This is the obturator internus, and this is the inferior gemellus. Okay, and this is the quadratus femoris here, the big quadratus femoris. Okay, so so this is the ischial spine or ischial tuberosity here. They originate from the ischial tuberosity, and they attach to the greater trochanter. Okay, so we have the superior gemellus, obturator internus, inferior gemellus, then we have the quadratus femoris here. Okay, this is the quadratus femoris, big quadrate shaped muscle. So that's about it for the gluteal region. As we go down, we come up with the posterior thigh region. Okay, which the muscles that we see here is the hamstring muscles. Okay, so these are the hamstring muscles. So what we see here is basically on the lateral aspect. This is the lateral aspect of the thigh, posterior thigh. And we see the biceps femoris. This is biceps femoris. This is a long head, and this is a short head. So this is the long head of the biceps femoris, and this is the short head of the biceps femoris. As you can see, the long head goes up and then comes out from the ischial tuberosity here, along with the semitendinosus and membranous. So all these three muscles originates from this guy here, and this is the ischial tuberosity here. Okay, so this is the long head. All right, this is the short head. As you can see, the short head originates from the linea aspera on the posterior aspect, and we have also the lateral supracondylar line. So those two parts would serve the origin of the short head of the biceps. So this is the long head of the biceps. This is the short head of the biceps. Here they fuse and they basically attach to the lateral to the femur, the head of the femur. Okay. So this is the biceps femoris, and on the medial aspect we have semitendinosus. This is semitendinosus, by the way, here. Okay, so it's tendon shaped at the end here. It's rounded part. It's rounded. All right, it's semitendinosus. Below that, which is this guy here, is semimembranosus. As you can see, it looks like it has a membrane shaped. Okay, so you see this white area. It's like it's a tendon, and if you look at the shape, it's membrane. Okay, it's like it has a membrane shape, a flat shaped structure. So this is semi-membranosus, and this is semi-tendinosus. And again, all these muscles originate from the ischial tuberosity here, and so basically they attach to the medial part of the tibia, the medial condyle of the tibia. And semitendinosus, we can't see properly here. It attaches to pes anserinus along with the gracilis and sartorius muscles in the and forms the pes anserinus. So these are the hamstring muscles. Okay. So what do we see here? So the sciatic nerve, as it goes down here, along on top of the deep gluteal muscles. Okay, it passes on the superior gemellus, obturator internus, inferior gemellus, and quadratus femoris. As it goes down, okay, it goes under and through the through these two hamstring muscles. Okay, we can see the sciatic nerve here. Okay, this is also sciatic nerve, but as it comes closer to the popliteal fossa, it divides into two categories, two nerves. Okay, one. Okay, let me. All right. Yeah. All right. So basically, it divides into two parts, two branches. This branch will be the tibial branch. Okay, it goes to the posterior aspect of the leg, and the other branch, which is this branch here. All right, this branch here is the common peroneal nerve. Common peroneal nerve, as you can see, it goes to the lateral side. It goes to the lateral side, and it goes to the neck of the fibula, and there it divides into two branches: the superficial and deep peroneal nerve. And so this is the common peroneal, and this is the tibial. The medial part of the sciatic nerve is tibial. The lateral part going towards the fibula on the lateral part of the leg would be common peroneal. And common peroneal gives off motor branch to the short head of the biceps, by the way. Okay, so the hamstrings primarily are innervated by the sciatic nerve, or the tibial branch of the sciatic nerve. However, the short head of the biceps receives motor branch from the common peroneal nerve. So this is the popliteal fossa, by the way. Okay, so this area here is the popliteal fossa. Hold on, let me get this. So this area here is the popliteal fossa. All right, and so it's like a diamond-shaped structure here. You have the biceps femoris on the lateral side. We have the semitendinous semimembranous on the medial side, and we have the gastrocnemius muscle, both the medial head and lateral head. So we have the diamond-shaped area, what we call the popliteal fossa. So one of the important structures that we see here, or two important structures, would be the popliteal vein and popliteal artery. So this is the popliteal vein here, okay, and below that we have the popliteal artery. Okay, so this is I'm just dividing them. So this is the popliteal vein, and it's the popliteal artery. And as you can see, these popliteal vein and artery come out from what we call as the hiatus, okay, or adductor canal, adductor hiatus. On the anterior compartment, the femoral vein and femoral artery goes through the hiatus, through the adductor magnus muscle, through the canal, and then comes out in the popliteal fossa as the popliteal vein and the popliteal artery. Okay, so basically the origin of these are the femoral vein and femoral artery. Okay, I think that's about it. Okay, so basically we finished the gluteal region, okay, and we looked at the posterior compartment of the other side, the hamstring muscles, and their locations, everything. So I think I covered most of the things, and okay, that's about it then. Thank you very much for listening, and bye for now. Bye.